of the previous video of mine, where I have discussed that what is this intracytoplasmic sperm injection. So in succession to that video, in this video we'll see that what are the steps involved in the process of intracytoplasmic sperm injection. So before getting into the steps, just we have a brief overview, that is what is this intracytoplasmic sperm injection. So actually, in the routine in vitro fertilization process, what do we find is that in the laboratory, in a petri dish, in a laboratory dish, what is done is a single ovum is placed and thousands of sperms are surrounding it in the lab environment. So that process in which a single ovum is being surrounded by thousands and multiples of sperm, multiple amount of thousands of sperm, and it is left for chance that those sperms are going to fertilize. So this process is called as in vitro fertilization. So actually in the process of in vitro fertilization on a petri dish, an ovum is placed and it is surrounded by numerous amounts of sperm. It depends merely on chance that which sperm is going to fertilize the ovum and lead to the formation of an zygote. So actually in the process of intracytoplasmic sperm injection, so the word itself is suggesting that intra means inside, cytoplasm means within the cytoplasm of the ovum. The sperm and a single sperm is going to be injected into the ovum of a single ovum. So intracytoplasmic sperm injection is the process in which a single ovum is fertilized with a single sperm, and that leads to the formation of an zygote, which later on, when it progresses to the multiple cell stage from zygote to morula to blastula, and from this, once the blastula is formed, that blastula, then this blastula is transferred into the method of implantation. So this intracytoplasmic sperm injection, the most important thing is that a single ovum is being fertilized by a single sperm. Now, what are the steps involved into it? So actually, there has this intracytoplasmic sperm injection is done, it is proceeding in a sequence of 6 steps. So the first step is the ovarian stimulation or the ovulation induction. So ovarian stimulation, what does this mean? Actually, in the woman, the couple who is trying to conceive, in such a situation, the lady who's trying to conceive, she is given certain amount of injections, and those injections, the person who's supplying the eggs, she is given certain amount of injections for the period of 8 to 14 days. She is being injected. The injection's name is Lupron or the HCG. So she is being this drug is being injected to the person who is supplying the eggs, and this injection of 8 to 14 days is going to induce or stimulates the ovaries for the production of multiple ovum. So once the stimulation of the ovary is there and the ovary gets stimulated to produce number of ovum, so this process is called as ovulation induction as well as ovarian stimulation. So actually later on, once this injection Lupron is being given, so that is going to stimulate the ovary for the production of number of ovums. And afterwards, the HCG hormone, that is the human chorionic gonadotropin hormone, will assist in the final maturation of the egg. So the first step was ovarian stimulation or the ovulation induction, where the ovaries are induced to produce eggs. The next step involves egg retrieval. Obviously, once the egg stimulation, the ovaries are stimulated, that is the ovulation is induction is done. Afterwards, the next target comes is how to retrieve the eggs, how the eggs are going to be retrieved from the female reproductive tract. Now, in this situation, what is done is the healthcare professional uses a transvaginal ultrasonography method. So through the vagina of the lady, the sonography is done and the tracing of the ovum is done. How, where the tracing, how the ovum, where the ovum is there, its tracing is done, and with the help of a syringe, then a syringe is inserted into the wall of the vagina into through the ovary. Now, once my syringe is inserted through the vagina, and the needle will be inserted into the ovary to extract or to retrieve the eggs. So this procedure is done using the help of mild anesthetics. So these mild anesthetic will make the procedure more convenient for the lady undergoing through it. Apart from this, this will make the patient predisposed to lesser pain. So she'll be having lesser discomfort and lesser pain if mild anesthetics are being used for extracting the eggs through the vagina. Needle is inserted and to the ovaries, and from there the egg is extracted once the process of ovulation induction has been carried out. So actually then the next steps comes is, now the ovum has been extracted. So herein the part of the female gets over. Now what comes is, next step is the process of sperm collection. So actually the process of this intracytoplasmic sperm injection, it is mostly done in those men who are having infertility issues. So it is actually the men who are involved, who are having issues, who are having the problem of infertility. It is their mode of treatment modality. This treatment modality is implicated for such men with infertility issues. So now what is going to be done is that the person who is supplying these sperms, so such a person, this on the day when the fertilization has to be taken place, has to be done, on the very same day the sperm collection is being done. And how, what are the necessary instructions, what is given for the sperm collection? So most importantly, the person who is supplying the sperms, he is asked to abstain from sex, and he should abstain from masturbation at least 2 to 3 days before giving the sample for the sperm, before giving the ejaculate. So such person is asked to, he should strictly abstain from sex from the previous 2-3 days, and he should abstain from masturbation from the previous 2-3 days prior to the collection of the sperm sample, prior to the collection of the ejaculate what he is going to give. So in such a situation, such men, the collection of the ejaculate or the collection of the sperm is done either by masturbation, whether the person is going to do it at his home in the laboratory container, or he's going to do the same process of masturbation just to take out the necessary amount of the semen in the lab container in a private room in the doctor's hospital. So the person who is supplying the sperm, these are the two methods. Either he can do it at his home as per his convenience, or he can do it in a private room through the masturbation, and the necessary amount of semen he can ejaculate, and he'll store it into a laboratory container. But the most important thing over here is that this sperm collection, once the ejaculate has been deposited into the lab container, this must be sent to the laboratory where the process of the intracytoplasmic sperm injection is to be carried out within 1 hour. It is the most important condition because the sperms are highly motile during the first hour after the proper ejaculation. So do remember, the most important criteria over here is that whatever whatever person is supplying the sperms, he should be delivering the container containing the semen. It needs to be delivered to the laboratory within 1 hour of the ejaculation of the semen. So this is a very important criteria for sperm collection. And apart from this, I would like to emphasize that before the sperm is being tried for in vitro fertilization, what it is done is the semen analysis is very, very important. Why? Because whosoever is the donor of the sperms, actually his semen analysis is very important, just to look for what is the quality of the sperms, what is the quantity of the sperm he is having on, and what about the motility of the sperms. So these 3 parameters needs to be assessed about the quality, the volume of the semen, as well as the motility of the sperms, how the sperms are motile. So these 3 parameters needs to be assessed before conducting the process of intracytoplasmic sperm injection. Apart from this, people with who are suffering, who are having the problem of azoospermia, or the problem of the issues of anejaculation or retrograde ejaculation, they require special methods to retrieve the sperms from them. So actually these are the people who require special methods, because in their masturbation, in their ejaculation, sperms won't be present. So such people who are suffering from this all problems such as obstructive azoospermia, anejaculation, retrograde ejaculation, they need special methods through which their sperms can be extracted. Apart from this, later on, once the sperm has been sent to the laboratory, now the fourth step involves is creation of the embryo in the lab setting. Now once the sperm and the ovum are available in the laboratory in a petri dish, this injection of the sperm is done into the cytoplasm of the ovum, all right, through into the cytoplasm of the ovum. The ovum is held in position with a pipette. Apart from this, injection of the sperm is there inside the ovum cytoplasm, and later on this will lead to the formation of a zygote, and within the period of 5 to 6 days, the blastocyst, it will be observed once the fertilization has taken place in a controlled atmosphere. The healthcare professional who's conducting this IVF, is going to observe that within a period of 5 to 6 days whether the zygote is getting multiplied, the zygotes, the cell what is formed, it is getting multiplied, and finally when it reaches to the blastocyst stage, that is by the 5th or the 6th day, it reaches to the blastocyst stage. At that very moment the embryo is implanted. That is, the last step is the embryo transfer. So at that step the embryo is implanted 5 to 6 days after the egg is retrieved. So it depends, once the healthcare professional is going to insert this fertilized this blastocyst into the uterine cavity, it depends merely on chance that whether it is going to lead to a successful pregnancy or not. So they will wait for a period of 7 to 10 days, 15 days to check whether the pregnancy, the lady who has been given this ICSI method, she has conceived or not. So actually they wait for the pregnancy test to come proper, and in certain cases there are certain couples who say that if their single zygote is going to get failed for the implantation into the uterus, they also ask for the implantation or for the injection of in the embryo transfer. They want that multiple embryos should be transferred into the uterus. So in such cases there can be a chances that even the person who is undergoing this treatment modality, she might expect having twins or triplets. So if multiple embryos are being transferred into the female's uterus, so there might be a chances of getting twins or triplets as well, but they have their own complications related to it. So mostly that depends merely on the chance. Once the embryo is being formed, then the blastocyst stage, after the 5 to 6 days of egg retrieval, the blastocyst, after the entire procedure, the blastocyst will be formed, and this blastocyst will be implanted into the uterine cavity. If it attaches to the uterine wall, a successful pregnancy takes place. So most of it has been found through researchers, through various years of research and experimentation done on these things, it has been found that about 50 to 80% of the cases of intracytoplasmic sperm injection, they are successful. So students and viewers, this was a very short discussion where I have discussed what are the steps. The first step, in the nutshell, we are going to describe. The first step is the induction of the ovulation or the ovarian stimulation. The next is the process of egg retrieval. The third is the step for the sperm collection. The fourth step involves the creation of an embryo in a laboratory petri dish. Apart, in a lab setting, the creation of the embryo is done. And last step, that is the embryo transfer into the uterus. So students and viewers, this was a very short discussion where I have discussed about what are the steps, what are involved in the intracytoplasmic sperm injection, and how this entire procedure is being carried out. If you still have any queries or comments, you are most welcome to comment me in the comment section. And students and viewers who are new to my channel, who haven't subscribed, Subscribe and don't forget to press the bell icon so that you can be further updated for my upcoming videos. If you like this video, give this video a thumbs up. Thank you for watching.